Thank you for joining us on the program City Pulse on Housing TV Africa. I am Phoebe Onwabwije. City Pulse is a program brought to you by the Nigerian Institute of Town Planners, a town planning association recognized in Nigeria and globally. And on today's episode, we will be discussing the role of public convenience in urban livability. I won't be doing this alone, as I will have joining me in the studio town planner Samson Olusegun right after this break. Please stay with us.
Visit Housing TV Africa on YouTube and click on the subscribe button. Subscribe to Housing TV Africa to stay updated on latest happenings in Nigeria's housing sector. Follow our social media pages, like and share our posts on Facebook, Housing TV Africa, on Twitter, Housing TV Africa, Instagram, Housing TV Africa. Join the conversation and keep up with latest housing updates.
Thank you for joining us once again. The program is City Pulse, a program brought to you by the Nigerian Institute of Town Planners, a town planning association recognized in Nigeria and globally. I am Phoebe Onwabwije, and I have here with me in the studio town planner Samson Olusegun. You're welcome. So, as I stated earlier, we'll be discussing on the role of public convenience on urban livability. We've had a discussion on that previously, but this is a continuation of that. So, to begin, town planner Samson, let's quickly, just take a background check. What is the importance of public convenience on on the society, both urban and rural areas?
Okay. Interestingly, a study shows that a toilet is where people will most likely visit whenever they get to a new location.
Okay.
So, bringing it in the urban livability scene, it would mean that the quality of the experience a person has with a public toilet or a public convenience might substantially impact how they view the urban experience, okay, how they feel about the urban experience. Because if you had a good experience in the toilet, say it was accessible to you, it was clean, you were able to get in and all of that, and you did your business in a very convenient manner, you are most likely to have a good experience, and you could even rate that experience as good in the entire urban experience. Of course, your urban experience is beyond just the toilet.
Yes,
how you get into your city, where the distance or the convenience of getting to work from home, the facilities and all of that, the quality of those facilities, but also if it is easier for you to access, to use a public convenience, then you could say that would be a good urban experience. Okay,
let's use the reports you just talked about. So how do you think an average Nigerian rates the urban city? Judging from public conveniences, we know. So just tell us.
So it is very likely that the average urban resident wouldn't rate his public convenience experience well. It's either it is not accessible to him, it is not even provided at all, or it is not well maintained, he can't access it. So in terms of access, there's social accessibility, economic accessibility, physical accessibility. So if you say physical accessibility, how was it designed? If someone is on wheelchair, can he access a public convenience? How can the aged access it without much help? Is it easily can you easily sight the public toilet? Do you feel safe using the public toilet? That's your physical. For social, you know that we are a multicultural society.
Yeah.
We use spaces differently.
Yes, we do.
Would it, can I access it? Can everyone in the urban space access it socially? Now, economically, there are some charges for some toilets. Now, if I am poor, right, I can't afford, say the charge for accessing the public toilet. Now, is it accessible to me? So these three can form whether or not an average urban resident in Nigeria is able to access your public conveniences.
Wow. So if all of these things are not present, which in reality they are not, what are Nigerians expected to do? How do they cope?
It can be challenging. I have experienced or seen people go through challenges like really pressed in very uncomfortable places. Some people have had to just damn the whole shame and all of that and just go down. Especially women, you know. For a man, once you turn to a wall, you're covered. Now look at the aged, disabled. People naturally would even be disadvantaged in a regular setting. So you can expect that even in accessing such facilities, they would have also even a greater challenge. So that's where the challenge would be.
Okay, now let's move down to the Nigerian government. What's the role of the government in the provision and maintenance of these public conveniences? Because when we talk about these public conveniences, we know that it is for the public, and who takes care of the public if not the government? So what are their roles in providing and maintaining these social amenities?
Okay, so we have to try to see our public conveniences to be seen as a service or as a product.
That's very interesting.
So if you're seeing it as a service, the government is supposed to provide a service.
Okay.
Because it's not just about the public convenience, it's about what not having it does to the environment. The air quality, how it affects the water quality, how it affects your experience socially within that space. We see most of our public spaces, markets, motor parks, there's a kind of stench that comes from most of them because you don't feel good going there. Because I was in one park, I mentioned the name yesterday, and I had to rush out of a certain location because of the stench coming out. The stench there. So we need to understand that. And interestingly, that place has a public toilet. It's a motor park. It has a public toilet. One, I have used that public toilet before.
Okay.
It is not exactly a place where you want to be, except it's an emergency. You understand?
Which is not supposed to be so.
Yeah, because it's not well maintained. It's been built for a couple of years. I used it a long time ago, so I can imagine how bad it could be now. So there are people who, despite the fact that there is even a provision, would not want to use it because I'd rather just use the open system, because I feel maybe even it might be even healthier in my own mind that using the open system is better for me, because I might just catch some infection. For a man, we say it's easier, but for the woman, she has more considerations when she's using public facilities, and most people don't feel safe. They don't feel it's healthy to use public conveniences where they are available. We're not even talking about where they are not available at all. So
are there government policies that oversee these things, that make sure that, okay, we construct, when you even talk about the ones that are available, they cannot cater for the number of population that we have. So they are not enough. And then the ones that they have managed to, erect, how can they be maintained? Because you narrating your experience to me, it's actually saddening. It's actually, and it's an issue. So are there policies that oversee these things and ensure that, okay, the right things are being done?
Because we have to understand also that public conveniences are elements, important elements of public infrastructure. So for any space that is termed public or that has any environmental value or people converge at all, we have to make sure that public conveniences are not just a convenience or something that you just add as a feature. It's part of what must be there for every public space, public buildings where businesses and all of that. So that is a policy, right? Now, do we provide them intentionally? Because now, let's say for every highway, just as you have your road furniture, your markings, your bus stops, you should also have public conveniences. We should have terminals. Terminals should have public conveniences. Parks should have public conveniences. It is not a matter of you want to provide it. It's a feature.
That must be provided.
It has to be provided. So that is natural. It is a policy. And so we can now talk about whether or not it is being implemented is a different issue. So let's take a case of our highways. Do we have public toilets on these highways? Our major roads, our parks, are there public toilets? where people, wherever you have a lot of people gathering, there has to be public toilets.
It has to be.
So the challenge is not whether or not there are policies, it's whether or not they have been implemented.
They have been implemented.
So who ensures that
They
public toilets are available to the people to use? So I think that's where the misnomer is, because there are a lot of we know about the executive order by the President Buhari in 2021 to end open defecation by 2025. Now, after the executive order has been signed, we have Ruwasa in all these states. But what is being done on ground to ensure
that it can actually be stopped? Because if you don't provide these things, how do you expect them to stop doing the other one?
Everyone has to. It's part of a makeup to say you need to. If you take water in the next 1 hour, 30 minutes, 1 hour, you need to use a convenience. And sometimes it might not be in your home environment. It might not be in an environment where you can easily access a convenience. It might be in a public space. So when you have to go, you have to go.
You have to go. You just have to go. So now let's talk about, you were talking about public convenience. You said could either be a service or a product. So let's come down to the product. When you say it could be a product, what do you mean by that?
So we understand that there are costs attached to really maintaining public facilities, not just conveniences. Let's take Abuja for an example. There are people who have contracts to operate and manage public toilets. They charge a certain fee. Now, I don't know whether that is profitable enough or that is plowed back into maintaining these facilities. Now, if we are to solve the problem of, say, public conveniences, and we say we are bringing in the private sector is profit-driven. It's profit-driven, the private sector.
Okay, profit-driven.
Yeah, so now, the government can say, we give you equity in land. The government has the rights to land, especially the state governments, or in the case of federal, maybe the federal highway and all of that. So you bring in the private sector, tell them, okay, we have equity, so you don't have to buy land. Provide toilets. We sign a contract. You maintain these toilets for a certain period of time, probably renewable. And because you are still trying to make it accessible to people, it will maybe go at the market rate, because yes, it is still government partnership and all of that. So there has to be that accessibility. You know, we talked about cost earlier. So if the man is trying to recoup his money in 10 years, you could say, no, let's make a timeline of 20 years to bring down the costs, so that when it is provided, people can use it and they are not excluded based on the financial implication of using such toilets. I think that's where we can talk about it being a product.
Okay,
so
about it
you bring in the private sector, make it financially feasible for them to actually say they want to come invest.
Okay, but you know that when you bring in the private sector, it also has a financial binding on the people that are going to be using it, that is the customers. We'll be discussing that after this break. Thank you very much, Town Planner Samson. Let's quickly go on a short break. We will be back. More discussions on the role of public convenience in urban livability. Please stay with us.
Visit Housing TV Africa on YouTube and click on the subscribe button. Subscribe to Housing TV Africa to stay updated on latest happenings in Nigeria's housing sector. Follow our social media pages, like and share our posts on Facebook, Housing TV Africa, on Twitter, Housing TV Africa, Instagram, Housing TV Africa. Join the conversation and keep up with latest housing updates.
Welcome back. The program is City Pulse on Housing TV Africa. City Pulse is a program brought to you by the Nigerian Institute of Town Planners, a town planning association recognized in Nigeria and globally. I am Phoebe Omar-Bridget, and I have been having this discussion with town planner Samson Olusegun. So, to continue our conversation, before we went on that break, you were talking about if it is a product, that is, you have to bring in the private sectors to maybe transact with the government to provide these social amenities. We should also know that when it comes to that level, it also has a financial binding on customers, the financial consequences on customers. So if it is to be done that way, that means it will no longer be affordable for an average Nigerian. What do you have to say?
I like the term you used, affordable.
Yes.
So the truth is, as we earlier said, if the private sector is coming, however long it might take, the idea is to make some money. Of course, the government is to temper that need to make the money and still offer a hybrid of a service, but still a product. Ensure that the toilets are well maintained. These people will employ staff. There will be some, let's say, things they will have to change, say, your toiletries and all of that. These things have to be maintained and renewed all the time. So there are costs attached to actually having these desired public conveniences. So there has to be a charge. But then we have to determine what charge is affordable. Is it 50 naira? Is it 100 naira? That will have to be determined. Of course, in order to determine that, you can't sit in an office and say, we are fixing this charge.
Yeah. You have to carry out a survey.
You have to ensure that, okay, people
should,
exactly. So let people understand that, okay, we're providing this. So how much do you think you can pay? So that the people feel they are part of the process in even the price fixing.
If you ask an average Nigerian, because I've been in such situation where, okay, we'll do this for you, how much do you think you can afford? And they'll tell you, why not do it for free? Why not do it for free? Is it not the government? So, so you calling them to deliberate with you, I don't know.
You will find that people are actually willing to pay for services that are good.
Okay.
We've talked about, we earlier had a story about someone who was in a very bad state and just had to go. Ask that kind of person, what price would they have paid at that time?
Anything.
You get it? So if people know that there's a need, most people would rather not openly defecate. But they do it because they have no choice. So if such people are able to pay, it's dependent, not that you are paying the cost of the toilet, you are paying the cost to use it per time. And of course, the government is wading in because it has reduced the cost of developing these toilets by giving equity and probably some support or some maybe tax break or anything, just to ensure that the cost is as low as possible. But costs have to be paid because whoever is operating or who is building is actually also running a cost. Okay. And there has to be a balance.
There has to be a balance. Yeah. For it to be a business, because
it has to be viable,
yes,
but also it has to provide the public goods for the people, which is the essence of the entire. So if you build and nobody is using, then there's a bad investment there.
What's the need? Yeah. Okay, you talked about while you were talking, you talked about providing conveniences at each bus stop, if possible. At every bus stop, you said something like that.
No, I didn't mean at every bus stop.
You said if possible.
At convenient distances.
Okay, at convenient distances. Yeah. Okay, that is not just convenient distances in specific locations where it will be easily accessible. And that's where we bring in the NITP, because it's the role of the NITP. We believe that it's the role of the NITP to plan the city, not just the city, but also rural areas. So what are the plans that are in place for public conveniences?
Okay, we are glad to be partners with Housing TV. Okay. The NITP, as you know, we are professional town planners, and our aim is to ensure that we create livable settlements.
Yes.
Part of the livability is to ensure that people have access to public conveniences. But public conveniences in themselves are not exactly a land use that you can say, I'm providing land for public conveniences. As I said, they are a feature of land uses, especially public uses. So, if I have a park, or wherever people converge, terminals, public spaces, public toilets should be provided. So it's a matter of policy. It is not as though you are going to create this land, have a public toilet here. But as I said earlier, a right of way would naturally have, say, lay-bys, service lanes, bus stops, and public conveniences, which are not yet features that we see commonly in our Nigerian cities. So that is where NITP comes in.
Okay.
We will promote, of course, in advocacy to ensure that people do the right things. but the policies are there. And this is, as you said, is a design matter, which means that cities have to take it up. The standards are there to ensure that everyone has access to these public facilities. But then implementation of these policies would be key to ensuring that it is delivered to people. And in rural areas, you know that the rural area is different from the cities. The agglomeration of people is not as much. So yet people still have public spaces in rural areas. So let them be provided for them there, and also to ensure that you maintain the quality of the environment in those areas. The provision has to be still accessible. And you know, we've mentioned 3 dimensions of accessibility.
Yes.
Socially accessible,
physically
accessible, and economically accessible.
Report has it that for like better accessibility and for an improvement, digital payments was advised, digital payments for each use, smart toilets and the rest of that. Do you think Nigeria as a developing country is up to the task? And what can we do?
Yeah, let's get to the business of providing first.
Okay.
And then, of course, it's good to infuse smart technologies into how we use things, because what smart technologies do is that they reduce waste, they ensure efficiency. So, and naturally, we're really talking about how we don't have enough resources. So, actually bringing in smart initiatives into how we use our public toilets would save us more resources that we clearly do not have. So yes, smart technology can be brought in, but provide them. And since we're not trying to provide them, why not go with best global practices?
Yes.
Bring in smart technologies to reduce waste, of course, energy efficiency. You want to know who has used your toilet. You might even want to get some data from who is using your toilet. Are there more women using toilets? Are there more men? Are there people who have children using the toilets? Of course, we expect that such designs will accommodate everyone. Children, the adult, the aged, the disabled.
Yeah. People with special needs.
Exactly. Pregnant women, nursing mothers. All of this has to be inculcated in the design of these smart toilets. Yeah.
But for now, let's just focus on the provision.
Yeah, provision with smart technologies. That's the idea.
I hope those that are in charge, those that it's their responsibility, I hope they are listening to us, because we do not want a situation where we are still on the same level. These things have been provided and it's the same old kind of standard that is not, because we are now in the new age. We need something that is better than just normal. So what are the future challenges that you are seeing? Because this thing has been an issue in Nigeria for, let's say, countless times. We can't even. It has been an issue in Nigeria for quite a long period of time, where we see people pressed and they have nowhere to go. They have nothing to do. I'm sure you would have also been in that situation one time or the other.
Almost everyone will have been in such a situation.
Yes, it's a general thing that has to be tackled. So what are the future challenges and what are the opportunities that you see in the nearest future?
Okay, so to buttress your point, that same study I was referring to, 2021 study, says that about 50 million Nigerians actually openly defecate. About 50 million Nigerians. So the challenge we have is this. Recently there was a cholera outbreak. Yes. And if you notice, most of these outbreaks are in cities, urban areas where a lot of people come together.
Population is
when there's population, and most of them are practicing open defecation in open places, open spaces, public spaces where most people go to, you have on your hands an environmental challenge, a public health challenge. Because once they say an infected person who has openly defecated, an airborne disease is on the rise. And because it's a public place, people are coming together. So you can have an outbreak of a pandemic or anything just because someone who is infected openly defecated and something airborne has taken it up. And that is how you have cholera outbreaks and all that. Now, if you are saying openly defecating close to a water source where a majority of people are using, so you mean people are now using unsafe water, ingesting that water. So for me, the major challenge is health, and not tackling the issue of public defecation or public not having public conveniences that now leads to the open defecation is a challenge on our health system. So we are already having pressure on health system. We have an inadequate health system. So not providing the facilities that might look costly now is actually going to be costlier in the long run.
It's real.
So that lies the challenge. So to provide this is to save ourselves as Nigerians the stress of losing man hours on sick beds, of losing lives, of losing the quality of life. Because as we said, when there's open defecation, even the air around that area,
it becomes very uncomfortable.
So the quality of life of every Nigerian is at stake when public conveniences are not provided where they are needed. So providing it is not just about not openly defecating, it is the ripple effect of such.
That's very informative and saddening at the same time, because these things are very important. In as much as we try to overlook them, they are very important, because everyone has these needs. They have these needs. So are there any opportunities in this, or are there just challenges?
No, the opportunities are this. Okay, I heard, I can't confirm that, there was a company who once came to a city in Nigeria, and all they wanted was they would provide public toilets, and all they were interested in was the byproducts in order to produce biogas.
Wow.
So these are not exactly waste, because the idea would be that where available, public toilets should be connected to the city sewage system that would then be, of course, recycled into maybe water still, because yes,
if it's not going into water,
your sewage, the sludge, you get water back.
Is it usable water or
sure.
Wow. Okay.
It's a resource. Okay. By the time everything is separated, you have your clean water.
Look, Nigerians, please get your information right before.
No, sewage is sewage. It has water. It has the energy aspect of it. Okay. I was on Chongai Farms sometime early this year, and the entire system is zero waste. It means that once you use the toilet, that byproduct goes into the chamber, and it's converted to biogas and fuel for the generating set. Yes. So waste, human waste is no waste. It's a resource. So if you can leverage on these things, this is just one aspect. Just one aspect. Okay. So the opportunity is there. Of course, we've talked about the business part.
Yes.
Of course, you're not going to make all the money, but of course, you can still make enough money. So for the private sector, there's the part of the direct money you make from revenue. There's also the opportunity for renewable energy. There's the opportunity for a better quality of life. That you cannot quantify. You can't put value to quality of life. That smile on your face can easily be wiped off by a stench. If you just smell something, your mood changes.
It's true.
So these are the opportunities.
It has been a very interesting and educative session with you, Town Planner Samson. The knowledge you have brought to this program, it's very it's very interesting, because even you said that sewage can actually be, recycled and turned into reusable water. That is, we can actually can we drink that water?
Sure.
Okay.
Sure. Cities do it. Singapore does it. Singapore doesn't have water itself, so it has to recycle. So every water that is used in these systems gets recycled, sent back into the system. It's a cycle. That's why it's called recycling. It's a cycle.
Wow. I hope the Nigerian government knows about that aspect of, sewage. So probably if they do, they would provide more.
They do, because there are treatment plants. Yeah, so.
Okay, let's call it a wrap on today's episode of City Pulse on Housing TV Africa. The program has been on the role of public conveniences in urban livability, and I've been having that discussion with Town Planner Samson Olusegun. Thank you very much for staying with us on the program. Don't forget to follow us on all social media handles at Housing TV Africa. Also subscribe to our YouTube channel at Housing TV Africa. And also remember to download the Housing TV Africa mobile app on Google Play and Apple Store to stay connected. I am Phoebe Onwabuije. Thanks for watching and see you next time.